I would definitely say transformative, inspirational, and adventurous.
This is our last ride out with you.
We developed a needs assessment and went throughout the 6 parishes within Coral Sub-County, looking at the needs of the people in regards to community health, family health, HIV, AIDS, and malaria education and training. And so we really wanted to have these intimate focus group sessions with their local leaders and really look at what do they think they need, what do they want, and try to give them some tools and some education to empower them to develop themselves. So today, the information that I share with you is not just for you only, it's also for your family, your children, or you share people, members in your church, and other members of the community, so that you will all be empowered as a community and as a people, so that you all live long and healthy.
I was assessing some needs and giving some education about malaria prevention and treatment. So like why it is important to take full doses of malaria pills, why it is important to take care of your kids and take them to the doctor or health center. What are the symptoms of malaria?
Malaria you bel fumo ma chakol malaria ma.
So I would like to know how many people have mosquito nets in their house.
My living situation was quite interesting. We were a team of 4 people. I was the only male, and we stayed in a 3-bedroom apartment. I had my own room, but it was fun. We had our furniture, we had our speakers and music.
I can learn abroad is so different from what I can learn back in the States. And like those opportunities out there, they're available, were so like gave me a different like side, I guess, like different perspectives. So which I really appreciate, and then I started to see those values of, you know, like going abroad and to interact with these people, to learn about the cultures. So you said it's a violation of the human rights of how people are going to be displaced out of their homes. But we would like to say that the country as of now, it is under the poverty line. There are so many people who are not employed, and we are, as a country, we're at the bottom of the World Development Index. And it is a clear violation of human rights to leave our nation under the development. And we here have this great opportunity to open up the gate for the development. And
we aren't opposed to having Viper Metals come into our community. We just want to make sure that Viper Metals remains transparent and honest and keeps the best interests of the enlightened people in mind as they go forth and conducting their business.
So, as we the middle class, I wanna thank the Vipers company, because for us we have lived in this land for so long, and we wanna see progress. And our community, we would be very happy for the promise that you'll create employment, because when this company comes, you bring for us this company, we create for us this industry, we shall reduce the level of unemployment because many people will be employed. And the accents, when this company is created, the government will, national income also will increase, and the life of people, the life standard of people will also increase.
3 new words. Well, itimabe means how are you, and then I say atimabe, which means I'm fine, and thank you very much is apoyomatek, which we had to say a lot because we didn't know anything else to say. And Ningyanga is what's your name?
Okay. Okay.
The needs assessment went within Coral Sub-County, which is comprised of 6 parishes and 27 villages. We surveyed over 1,200 people. We looked at community health, family health, HIV/AIDS, and malaria. And the baseline that we constructed, we had these community meetings, which was led by their parish chief, local counselors, and ourselves. And we looked at various issues that they may have, and we basically asked them, what do you all know, and what are your needs? So further implementation and programming can be done. And these are just a couple of pictures of our community meetings. We basically met at, some of the meetings were inside the old IDP camps where many people are still living because they still don't feel quite safe to return to the villages, and are under a bush outside on their tree. So it was like very intense. So some of the major results, we're still compiling our final report, but these are some quick snapshots, some numbers to show you. 91.3% of the people lack mosquito nets. Of course, now that starting this week, Tam and the young leaders are going out and distributing nets, so that number will be reduced drastically. 85.7% of people reported not having a condom in the household, and that was one of the things we looked at as far as prevention and with HIV/AIDS. And another study done by the district actually looked at, well, do they know how to use a condom or where to go for a condom, and overwhelming 3/4 of the population knew about a condom and knew how to use it, so it's not necessarily the lack of knowledge. So there's some other avenues that need to be looked at. I really didn't know that the people would be so kind and so receptive, and that really was really humbling for me, and I was really honored how everyone greeted me and wanted to learn about me and about my country.
Wow.